Hello everyone, my name is Dr. Rani and welcome back to my 5-part series on macular degeneration. Today we are up to video number 3 in which I will explain what the symptoms of macular degeneration can be. So if you remember back to my last video, video number 2, I explained about the two main categories of macular degeneration. There's dry macular degeneration and there's wet macular degeneration. In dry macular degeneration, there are drusen or waste deposits that form under the retina, and there are actually 3 stages of dry macular degeneration. There's early, intermediate, and advanced. So in early dry macular degeneration, there are small drusen deposits that have formed, and in most cases, people have no symptoms whatsoever. So people have no visual changes whatsoever in the earliest stage. The only way to know if you have dry macular degeneration is to get an annual eye exam or get a dilated exam and have your eye doctor take a look in the back and see whether there are drusen deposits underneath the retina. That's the only way to know. Now, the second stage of dry macular degeneration is intermediate dry macular degeneration. And in this stage, people do initially start to have a few symptoms. They may be subtle at first, but symptoms of visual changes, particularly difficulty with vision in dim lighting or in poor contrast situations. So for example, it may become difficult to read in dim lighting, difficult to drive and see street signs in dim lighting or at nighttime, difficult to work in low contrast situations. Again, that is the common symptoms during intermediate dry macular degeneration. Now, the last stage of dry macular degeneration is advanced. And in this situation, the drusen deposits have grown in number and size, and they've actually caused loss of healthy cell tissue in the retina, and that's called geographic atrophy. That's a fancy scientific name for advanced dry macular degeneration. And in this stage of disease, people usually have significant vision loss. They've actually, because they've lost healthy retinal tissue, they actually have a central area where they do not see well. So basically a dark black or gray area, and it really does affect significantly one's ability to read, see things up close, do computer work or other work on a device, watch television, and see faces. So that's dry macular degeneration. Now, what happens in wet macular degeneration? What are some of the symptoms of wet macular degeneration? Well, if you remember what happens in wet macular degeneration, the dry form transforms into the wet, and there is leakage underneath the retina, leakage of blood and fluid and proteins. So basically, if you have your retina here and there's leakage of fluid underneath, the retina gets tented up. It gets distorted. And because of that distortion, people may experience a distortion in their vision as well. And there's a scientific name for distortion in vision. We call that metamorphopsia. And basically, if you look, for example, at something that's supposed to be straight, like for example, a door frame with straight lines, instead of seeing a straight line, you may see something wavy or distorted. That again is an indication that there is fluid underneath the retina or leakiness underneath the retina. So that is one symptom of wet macular degeneration. Another symptom is also a loss of central vision. Similar to the advanced dry form, people may have significant loss of central vision where there is a darkness or graying or blackening of their central vision, and they may not be able to, again, reading is quite difficult, driving is extremely difficult, watching television and seeing the faces of people is quite challenging. So it is quite devastating when dry macular degeneration advances to the advanced stage or it transforms into wet, because there's significant loss of central vision, loss of function. Some people are also legally blind from the advanced stages of macular degeneration. They can become legally blind, and also not only do people lose many of the joys of life, for example, reading and using a device and seeing faces, but they also lose their independence because basically they are not able to perform tasks that they used to be able to perform previously. So this basically ends my my third video in this series. In the next video, in video number 4, I'm going to be talking about who is at risk for macular degeneration. What are the risk factors? How do you know if you're at risk or not? So I will be covering that in my next video, so please stay tuned.